So you've been prescribed bisphosphonates, maybe for osteoporosis, maybe for bone cancer or Paget's disease, and everything's working out until your dentist says, we need to talk before we remove that tooth. Suddenly, you're in this weird crossover episode between bone health and dentistry. So what's the big deal? Can't we just pull the tooth and move on? Well, not exactly. There's a real risk here that everyone, especially patients and their families, should know about. Let's get into it. Hi, I'm Dr. Ashish Mehta, and I'm a dentist here in Northwest Calgary. I make videos like this to help you understand the hidden connections between your medical treatments and your oral health. Because sometimes, what seems like a routine dental procedure, like a tooth extraction, can carry serious risks. And if you're on certain medications, like bisphosphonates, well, that's one of them. They're powerful, effective, and long-lasting, but they also come with a rare complication that every patient should know before heading into a dental surgery. Bisphosphonates are meds that help stop bone loss. They're kind of like the bone bodyguards that slow down cells that break down bone. They're commonly prescribed for postmenopausal osteoporosis, certain cancers that affect bone, and even after certain surgeries. They work by binding tightly to the bone and hanging out there for years, not months, years. That long-term stay is part of the problem. So what happens if you need an extraction or an implant? Here's where things get serious. People on bisphosphonates are at risk of something called osteonecrosis of the jaw. So basically, the jawbone doesn't heal properly after surgery, and parts of it may even die. Sounds dramatic? Well, it is. It's rare, but when it happens, it's very hard to treat. It's especially risky if the bisphosphonates are given by IV, like in cancer treatment. But even oral ones like Fosamax can carry a risk. At our clinic, if we know you're on a bisphosphonate, we take a very cautious approach. We'll consult with your doctor, run blood tests to check markers of bone turnover, and avoid any invasive work unless absolutely necessary. Sometimes we even refer you for a special scan or pre-medicate with antibiotics. Oh, and if you're gonna go on bisphosphonates, it's smart to handle all the major dental work before you start. So the key takeaway, always tell your dentist about any bone medication you're on, even if you started 5 years ago and forgot all about it. We're not trying to scare you, we just want to protect you because your jawbone is kind of important. This is one of those areas where dentistry and medicine really need to talk to each other. So if you or someone you love is taking bisphosphonates, this isn't something to panic about, just plan around it. Let your dentist know, have a conversation, and work together on the safest possible plan. Dentistry is a team sport, and you're on the roster. If this video helped make any sense of a topic your physician probably didn't explain in dental terms, hit that like button, subscribe for more insightful breakdowns, and send it to someone who just started bone meds. You never know, it could save a smile, a whole lot of jaw trouble. Stay curious, stay healthy, and I'll see you in the next one.